Good day all, and you are welcome to our fifth video on CHCAGE013, which is work effectively in healthcare sector. We're going to be starting today with, if you are just joining us, please try to watch our previous video, and you're welcome to join us after that. So that will give you the full background knowledge of what we've discussed in the past. But today we are going to be starting with work with interdisciplinary team members. What exactly do we mean by this? Interdisciplinary team members are specialists from different backgrounds, and you as HK worker, of course, you'll be working alongside this particular specialist to provide the necessary support as well as care for people that's needing support that you are looking after. Some of the care provider have interdisciplinary team to provide services for other people. Such include the medical care, counseling care, personal care, administrative care, to mention but few. So each team member has their own role to take, and an interdisciplinary team can consist of one older person and several aged care workers. The members depend on the needs, of course, of that party of your clients. So knowing your role in this particular team setup is another very important thing, and for you to do that, you must respect everyone and appreciate what each members are doing or what they are bringing to the table. Work within your role and do not take over all the work or outstand your boundaries by overstepping into other people's specialty. And do not ignore any team member who needs help. Keep everyone up to date on details about what you're doing and how you're doing it. This is important in making sure that you are all on the same page and you're providing the best care that the particular client needs. What this is more or less what we call personal-centered care. Today we are using a lot of technology in the workplace, and being part of a very big team, the information sharing is vital. So you need to share information about the aged care, and this might include basic information, medical records, history of their care and services, and any kind of complaint or feedback that is expected. So using technology is an effective way of connecting with all these multidisciplinary team members, and technology has become the best way to connect with one another as well. So in doing your job, you need to be using technology to engage your team members and other people. You should have at least a basic knowledge of using the system that lets you do your job appropriately. For example, using of emails, phone, video meeting, groups, chat, to mention but few. So this will of course make your job much more easier. As I said earlier, when working as part of a team, the person we are looking after is that is the client, the older person. We should provide what they call personal-centered approach. What do we mean by this? This means putting the person at the center of the care. That is, seeing them as a person first and not as a case, or not as an illness, or even as an age. So aiming to protect their rights and dignity is very, very important. Focusing on matching service to meet person's needs and wishes. We should minimize the functional decline of the older person in hospital or even in our care, and increase the patient care satisfaction. This of course will make them to be happy, and we can get a very good result, as well as them having the best of out of what services we are providing. Decrease healthcare acquired infection that are likely to be paramount, particularly those that visited hospital lately. We should look after them appropriately so that they don't have what they call HAI, that is healthcare acquired infection. And we should at all times improve the functional status of our clients by helping them to gain more confidence, helping them to be much more independent as much as they can in a very safe environment. Older people in aged care have individual plans, so they can contain the older person medical and care information and what services or lifestyle modification they expected from us. So, as a care worker, we should familiarize ourselves with this as much as we can. And if a person cannot prepare, and when this particular care plan needs to be developed, the person involved also need to be part of it. But in case they don't have the capacity to be part of it, then we should engage their trustee or the person that is representing them. It is so if they can't represent themselves, we should assign the advocates or person that's going to be advocating for them. Benefits of individual plan include it ensures that older people do not just receive generic services that do not fit their needs, and it also enables them to decide when and how to receive that particular services sent to them. A person individual plan serves the following purpose. One, it tells the team basic and medical information about the person. It tells each aged care worker what to do for that particular person and when to do it. It also serves as a record of the person's goal and progress. It serves as an agreement between the person and the care provider, that is the organization we are working with most of the time. And older people need to exercise their right to choose. This allows them to be more active in running their own life. And below are a few ways you can support older person to exercise this particular choice. That is the first standard. Standard one, dignity and choice. So we should always demonstrate this at all times in a way by providing many opportunities for them to make choice from, help them to make the right choice, and give them options in a way that of course respects them and even improve or increase their level of capacity. And the use of personal-centered communication technique should be employed in this area because it of course promotes self-determination, and we can do this by following the following or by doing the following. We should make sure to focus on conversation on them and what they want to do. Whatever discussion we want to have with them, we should make sure that we are actually dealing with them and what is it that they themselves actually is looking out to achieve that particular time or even the day. And when making or reviewing an individual plan, constantly ask for their input. We should not think or we should not assume on their behalf. We should give them opportunity to say their view. And when they express desire to do something, we should help them to brainstorm and look at ways they can do it in a way that will of course be safe and be beneficial to them. We should be able to point out their strengths and suggest activities that highlight those strengths. We should encourage them to talk through their decision and express difficulties they are having, which of course we can help them to come up with ways of overcoming those difficulties. We should also provide them with opportunities to talk to people who have the same goal. With this, they will be able to be on the same page with other people. And just as I said earlier, we shouldn't be assuming that we are doing something for them. So whenever we want to do anything on their behalf, we are expected to seek their consent even before providing that particular care. So consent is a permission given by a person to another person to do something. It is essential to get consent before doing anything to your clients, and things to remember about getting their consent first is this applies to any action, especially one that involves you touching them in any way. Even if the person does not talk, you should still find a way of getting their consent by probably they showing you some sign language to confirm that yes, you can go ahead and do well, and provide that support that they are requiring at that particular time. And if you do not, if you do something to the person without their consent, it means you are actually violating their human rights, which is very, very wrong, and it's not expected of any good carer. So this is where we're going to be calling it a day today. Thank you all for your time, and I'll see you at our next video. Bye for now.